And as I was saying, with the guys who are out in America living underneath Las Vegas bridges, who have PhDs in computer science, for crying out loud, that shows you that something's really wrong. You know, there's another guy who was on a program over here, which prompted me to make this video. He had a infected appendix and also a hernia as well. His wife was trying to tell him to go to the emergency room, but because he was earning around $8,000, which is about £5,000 a year in our money, or about 7,000 euros, he was reluctant to go because he knew that he would lose his house, because if he enrolled in the insurance program, which Obamacare was trying to make everyone in the insurance system, where at the moment you've got private insurance providers linked in with both emergency room national providers, like that is their version of the National Health Service, but it's not free at the point of demand. Okay, so the guy may have paid tax for those emergency rooms, but he still has to have insurance to pay for to pay for his operation. He went to the emergency room because it was a life-threatening operation that he needed to undertake. They wanted to charge him $20,000. It's about £10,000. How on earth, on $8,000 a year, is he supposed to pay that? He's obviously going to have to, if he was that desperate to live and support his family in a coal mining region like Virginia. There's a very, very high unemployment and very, very dangerous but high skilled jobs in the coal mining industry. Then what's his alternative? When you've got a war, it might, ethically speaking, it might be necessary to use financial capitalism to cannibalise the economy so that the whole society could live. If you were playing the advocate of the man downstairs, for instance, you could say that, but I'm not. When you've got a system which has medical companies which are basically cannibalising the workforce of in financial terms, of the United States, then it's not the best system, is it? If that man loses his life, then his family's going to be out on the street, and the only reason it came to attention, other than his own physical pain and inability to work, was due to a British man who became an American citizen, opening a clinic and National Guards doctors, which is the American TA, providing some medical service to him. So the original idea of Thomas Jefferson, for instance, being that America was a meritocracy, and Thomas Jefferson and Tom Paine believed more in an idea of liberty and equality balancing, whereas Thomas Jefferson stressed also that property was a natural right, to prevent the government seizing your property or anything without reason due process. Is that really being articulated in that guy's life experience? It's not just his responsibility. He's a American citizen. If he was a soldier or something like that, who was wounded or had an infected appendix in a field hospital, nobody would be saying, no, you have to pay for your own medical treatment. What's the difference? Both of them are contributing to America as a society and as a national community, of citizens. um, it is to me, immorality is just a symptom of an irrational system, yeah. And when it becomes so apparent as that, then you need to start to think of ways to do it, get to change things. You know, Ron Paul's idea of dealing with a problem by people being able to opt out of who have the money to look after themselves, to thus sort of not bed block, as the NHS calls it, when people are in hospital, and thus free up the surplus for other people to use, because it will lower the cost and lower the competition between people. It doesn't actually get rid of the actual structural problem. He's trying to use that to get rid of the structural problem, but I don't think it's going to work, for the reason that people within a healthcare system based on basically what in Britain is called, in terms of housing, gazumping, yeah? It's where you put in a bid for a house, right? Or in this case, if you're an American citizen, you put in a bid. That's your price, your wages. You put in a bid for a bed, okay? Somebody who can pay more will go in and take that place from you. So what you've got in the American system is people who are patients who have need of medical help, so that they can go back to work, pay taxes, and contribute to the entire society of the United States as citizens, are competing against each other to see who has the most money to be able to survive and protect and maintain their life, so that they can feed their families. Right. So basically, the medical providers and the insurance companies have got you by the throat, and they can demand anything that they want, because they're controlling the factors that produce the price signals in that thing, rather than any sort of true competition or need from people at the point of demand. So that is the problem, and I think just by getting people to opt out is one thing, but if you get into a bad economic situation, like the guys who are living, and women who are living underneath Nevada's bridges with their children, who were once living in Silicon Valley, you know, doing computer firms, I mean, how are you going to opt back in? I mean, if Ron Paul is saying that you can just opt out of the governmental system and opt out of insurance, yeah, you're completely, you don't as he said, you don't expect the government to look after you. You're completely free, but you're completely responsible for yourself. It's a nice conceptual idea, but if you're not allowed to go back in, if he as president causes a barrier to entry, then that's not a free system. That would be a totalitarian system, because it's one model which has total control over the system of commerce and trades, as well as, you know, healthcare services. I hope that's not what he intends. I hope he wants people to be able to opt out or opt back in to the tax and insurance system on one hand, towards the government system,